Throw harder, they said. Chase velocity, they said. But what if I told you this obsession is destroying pitchers' arms? Major League Baseball dropped a groundbreaking study, and the findings are alarming. Velocity isn't just a stat, it's actually a major factor behind the surge in pitching injuries. But it doesn't stop there. Stick around, because what they uncovered might change the way you think about pitching forever. What's up, guys? If you're new here or you don't know me, my name is Dr. Cam, and I'm a double fellow and residency trained sports, orthopedic, spine, and manual physical therapist, as well as a faculty member in a doctorate of physical therapy program. On this channel, I provide you strategies and tools to get you to throw hard and stay healthy. Let's dive into this MLB study and break it all down. MLB's 62-page study identified several key factors behind the rise in pitching injuries, and here are the top contributors you need to know about. Number 1, chasing velocity. This study highlighted that the rise in average fastball velocity has directly paralleled the increase in pitching injuries. Higher velocities place significantly more stress on the ulnar collateral ligament, increasing the likelihood of ligament tears and the need for procedures like Tommy John surgery. Number 2, max effort every time. Modern pitching has shifted to a reliever mentality. Even for the starters, this means every pitch is thrown at maximum intensity, leaving little room for energy conservation or joint recovery. This trend exacerbates repetitive strain on the elbow and shoulder joints. Number 3, year-round throwing. Many amateur pitchers, especially in travel ball and showcases, throw without significant breaks year-round. This constant stress, coupled with developing growth plates in youth players, has led to a surge in injuries like little league elbow and other overuse syndromes. I just talked to a parent recently who could not even fathom to take 2 months off, and so they maybe will take 1 month off. Blows my mind. By the way, the kid was only 12. What? Number 4, weighted ball training. The study called for further examination on weighted ball programs, which can alter throwing mechanics and increase stress to the arm. While some programs yield improved pitch metrics, the long-term safety of these methods remains a little uncertain. Number 5, modern workload management. Ironically, strategies like pitch counts and innings limits may be contributing to injuries. The study noted that knowing they'll be in the game for a shorter time encourages pitchers to use maximum effort for each pitch, increasing the risk of injuries. I'm not really sure if I buy that one, because I'm not going to get in the game and throw a fastball slower than I usually throw the fastball. Number 6, a lack of cardiovascular training. Strength-focused training regimens have overshadowed traditional endurance building exercises. Pitchers now lack the aerobic capacity to sustain prolonged effort, resulting in fatigue that compromises throwing mechanics and increases injury risk. Again, not sure if I buy this one. I am a proponent of sprints over pulls, but that argument can be saved for another time. Number 7, off-season preparation gap. Tracking pitchers' workloads during the off-season is a significant challenge. Many pitchers report to season underprepared. Many pitchers report to season overprepared, leading to an early season spike in injuries. But how do you know who's doing what? There's so many variables to track. So again, I'm not sure if this point is that valuable, because the variability on training programs ranges. I'm at a facility in California that can be different at the facility down the street in California. Again, pro players. Number 8, misconceptions about surgery. Advances in surgical techniques like the Tommy John procedure have fostered a dangerous mindset. Some pitchers believe surgery is the safety net, failing to understand the high failure rate and long-term consequences for those who don't make a full recovery. Number 9, the impact of COVID-19. The disrupted 2020 season introduced unorthodox training routines, resulting in residual effects on pitchers' biomechanics and conditioning. These deviations likely contributed to the sharp rise in injuries over the past 3 seasons. However, I'm not too sure if I buy that one, because there's some people who just resulted to more bodyweight training and some people who bought a whole gym in their garage. So I don't know. How do you manage that one? How do you make that strong of a point? Not too sure. And last but not least, number 10, amateur level specialization. Early specialization in pitching combined with year-round training has led to an increased rate among youth and collegiate athletes. Growth plate injuries, ligament sprains, stress fractures are becoming alarmingly common, setting the stage for chronic issues and professional careers. This MLB study makes it clear we need systemic changes to protect pitchers. Potential solutions including incentivizing submaximal effort pitching, adjusting training protocols to include more endurance work, and rethinking workload management. Addressing these factors at every level of baseball, I think, is essential to keeping pitchers healthy and durable. Just remember, I'm Dr. Cam, and I got you.